boys and girls, today we're going to talk about trauma, in particular abdominal trauma, and kind of what goes into that. Now, we have two main categories of trauma. We have blunt trauma and penetrating trauma. We'll take a look at some of those in just a sec. Okay, first, let's take a look at blunt trauma. Now, it can be one of two things. An object hitting you or you squeezing or compressing you. Hey, babe.
What?
Will you help me make a video for class?
No.
Come on! Yes! Thank you, thank you, thank you, thank you, thank you! You have penetrating trauma, which could be something stabbing or impaling you. I'm not so sure about this scene. I don't really want to make this.
You said you wanted an A.
Now that we've covered the basics, let's take a look at how we would respond to any of these situations. Oh my gosh, are you okay?
My spleen.
What happened?
Car hit me?
Alright, let me check you out. You okay? Hey, stop. Make sure that they don't have a spinal injury before you move them. It hit your head.
Yeah.
Okay, can you feel your legs?
Yes.
Okay, alright. Okay.
Ow!
Alright, so you can breathe okay? You can breathe? You're alright? Alright, I'm going to call 911.
Awesome.
Blunt force abdominal injuries are very often accompanied by spinal injuries, so be sure to assess your patient for a spinal injury as well. But what about penetrating trauma? Well, let's take a look. What happened? Hey, what happened? Oh my god. Oh my god. No, don't touch it. Don't touch it. Just keep your hands right there, okay? We need to stop. Don't remove the object. It can actually cause more damage if you take it out, so leave that to the physicians.
I want to take it out.
No, we got to keep it in there. Let me call 911. Here, take these. Take with your one hand. Take with one of your hands. Okay? All right. Just hold it on. Once a victim is taken to the hospital, the staff there will perform certain procedures and techniques to evaluate and treat the injury.
On-the-scene care for blunt abdominal trauma is essential standard EMS action. This includes first establishing a patient airway and then continuing to assess for injuries, as well as C-spine immobilization of cervical trauma is suspected. Pre-hospital assessment and treatment of the patient with penetrating trauma is essentially the same blunt trauma. However, some differences are notable. All victims of penetrating trauma should undergo a primary assessment to detect any immediate life threats. This includes airway maintenance, assessment of breathing and ventilation, control of hemorrhage, and support of circulation, determination of neurological status, and adequate exposure of the patient for detailed examination. C-spine immobilization is indicated in penetrating trauma unless there is a direct injury to the spinal column. Once in the hospital, the patient will undergo a wide variety of tests such as diagnostic peritoneal lavage, also known as DPL. Which is, don't please put that in there, which is used to determine which patient needs exploratory surgery. I did so well!
She really did. Abdominal computed tomography, which is similar to, but more detailed than DPL. A focused assessment with sonography for trauma, or FAST, CT and MRI can be used as well. Surgical intervention may be needed, especially in the event of internal bleeding. So now you know a little bit more about abdominal trauma, what forms it can take, and how to treat it. Thanks for watching!
Hope you like our video!